Hi, my name is Olivia and I'll be talking about PTSD in nurses. PTSD in nursing. PTSD is a big issue that nurses face today and in the past, but it is also a topic that's not talked about as much as it should be. Nurses face high levels of stress due to exposure, whether direct or indirect, to different types of trauma. Gap in management. Specifically, high turnover rate is very critical in healthcare today and is heavily contributed to PTSD. Nursing vacancies, as well as an increase in utilization of the emergency department, can result in a large increase in the number of patients given to each nurse, which can lead to job dissatisfaction and result in an increase in staff turnover. My stance on PTSD is that the amount of PTSD among nurses shows an urgent gap between the support from hospitals and the demands of the job. This disparity is largely due to lack of support, resources, and major staffing issues. Some issues that arise from PTSD include sleep problems, cognition and mood, stress, job turnover, and work task avoidance. To start off with sleep problems, specifically the duration and quality of sleep is often affected due to PTSD. These are essential and vitally important for nurses because they normally work for lengthy periods of time per shift, with each of those shifts, more often than not, coming on consecutive work days. Cognition and mood. Along with disrupting necessary and quality sleep, nurses also suffer from alterations in their cognition and mood because of PTSD. Symptoms for ICU nurses specifically can include hyperarousal, re-experiencing the traumatic situations, and negative alterations in their mood and cognition. Stress. In certain specific circumstances where stress can become constant, a nurse's vulnerability and or personal predispositions will have a greater impact on the development of PTSD symptoms rather than the intensity of the trauma that is experienced. Stressful work environments for the nurse can also be a trigger for a nurse's PTSD due to the increased stress levels during care for critically ill patients. Job turnover. Stressful work environments are a major factor that contribute to high stress levels, which can impact nurse retention rates, specifically in the emergency department. Several nursing vacancies, as well as increased use of ED, can result in a large increase in patients given to each specific nurse, which can lead to job dissatisfaction and nurses leaving jobs. Work task avoidance. Many behavior changes caused by PTSD include avoidance of people, situations, and places which cause them to relive their traumatic experiences over and over, creating a dangerous cycle for that nurse. These issues can contribute to the risk for errors associated with PTSD, along with medication and charting mistakes, which can lead to the avoidance persisting. The financial impact of PTSD. Job turnover specifically has a financial impact on PTSD because it causes a big financial burden on the healthcare organizations through higher turnover costs for the amount of nurses that they are losing. Nursing meta paradigm. The person aspect of the nursing meta paradigm focuses on the patient, but in this circumstance, the patient will not be able to help prevent or treat PTSD. Environment. The environment is a major cause of PTSD, but you can't change what happens in the environment around you. Nurses have to go do their job in those stressful environments. There's no getting out of that. Health. Improvement of self-care by recognizing your individual struggles can help create a better work-life balance. Nurses should be prioritizing their own mental health and physical well-being, and some ways to help improve those things include exercising, meditation, and stress management. The nursing aspect of the meta paradigm. This goes over organizational effort to assist with mental health care. This can include providing more easily accessible mental health resources and options that include individual counseling or coverage for mental health treatments. The nursing process. The assessment part of the nursing process shows that nurses face high levels of stress due to exposure, whether direct or indirect, to trauma causing PTSD, which then leads to patient care issues. The diagnosis shows that nurses face an increase in symptoms of PTSD when they're exposed to stress, which causes mood changes and eventually job turnover. Planning. We need to create options and goals for mental health care for these nurses. Implementation. We need to provide assistance such as counseling services for nursing staff. Evaluation. We need to conduct check-ins with staff regularly to understand if they are coping well or if they need extra support or assistance. For the nursing theory, I chose Betty Newman's systems model. This model uses a holistic systems-based approach to help patients maintain stability by focusing on their relationship between the patient and the environment. The Newman systems model is a guide to strengthen the management of stressors in the workplace. For the change theory, I chose Lewin's change theory. This theory contains 3 different stages for managing change. The first stage is unfreeze. This stage involves communication as to why change is necessary, and it's also for creating awareness. This relates to PTSD because we need to recognize that PTSD is a serious issue and that it is often overlooked. The second stage is change. This is where actual change is implemented, such as providing counseling access and trauma-informed training. The third and final stage is refreeze. This stage involves stabilization and creating and making new behaviors. This relates to PTSD by help with doing and conducting routine check-ins for all nursing staff. I chose trauma-informed leadership. Trauma-informed concepts can be applied to leading and supporting healthcare teams. It may not be a classic theory, but it recognizes that nurses frequently experience trauma at work and encourages leaders to respond with compassion rather than punishment for their nursing staff. Some resources that are needed include individual and organizational. Individual resources include self-care, mental health, physical health, exercise, meditation, stress management. For organizational effort, organizations need to be able to provide accessible mental health resources, such as counseling, programs for employee assistance, and mental health treatment coverage. The nurse's role in this includes self-monitoring, such as understanding and accessing mental health resources that are available to them. Early recognition, such as watching for any sleep issues, avoidance behavior, or hyperarousal that can occur. And lastly, reporting concerns to a supervisor is also a major aspect of early recognition for the nurse. My individual professional nursing philosophy is rooted in the fact that I believe every single person deserves compassionate and evidence-based care that works for their unique experience. I view nursing as science that requires critical thinking, but I also believe that nursing requires communication, compassion, and empathy. Those are my references. I don't know.